The vigorous contact tracing that is going on at the moment across Victoria and New South Wales, assisted by contact tracers at the Commonwealth and in many other states and territories working remotely to help support our colleagues in Victoria, is being backed up by a remarkable testing framework. We have tested over 55,000 Australians in the past 24 hours, the vast bulk of those in Victoria and New South Wales. It is that ability to test rapidly, to turn around results rapidly, and to identify cases of COVID-19, then to identify contacts and make sure that people are isolated. These are the key elements of getting COVID-19 back under control in Australia at the moment. The breakdown of the cases, 20 new cases in New South Wales, all of whom were linked to known clusters, 275 new cases in Victoria and one additional case in Queensland. We have also seen an increase in a small cluster down in Batemans Bay, which has school holiday travellers, obviously from New South Wales and from the ACT. That occurred at the Batemans Bay Soldiers Club. What we've seen today is a remarkable example of the community getting out in force to get themselves tested. That is a model for how we need to respond to COVID-19, with a vigorous public health response, with pop-up testing clinics. That's been replicated in southwest Sydney in the past weeks and on a grander scale in Greater Melbourne and Mitchell Shire. We can't obviously do this on our own as government or governments. The community support that we're getting throughout this second peak of COVID-19 in Australia has been phenomenal and continues to be, I think, a source of great pride for all Australians, that we can go through this and again together to help the most vulnerable in our community avoid being diagnosed with this virus and potentially getting severe consequences from it. In that light, we should discuss the hospital capacity at the moment, in particular our intensive care capacity down in Victoria. In Australia, we have, as I've mentioned at these press conferences before, some of the most experienced critical care doctors and nurses in the world. We have a world-class health system, from our emergency departments through to our wards, through to our intensive care units. Health Minister Mikakos last week indicated that there were over 1,000 new beds created or upgraded since the start of the pandemic for intensive care in Victoria, 1,200 ventilators within their system. Now, at the moment, based on normal capacity in Victoria, only 82% of beds are currently being used. That is mirrored more or less, is also the case nationally. Now, that's an important number, that 82%, because in the middle of what we would usually term as our flu season, where our intensive care units would often be close to 100% capacity, we still have existing capacity within our system without surging. Down in Victoria at the moment, less than 1 in 10 patients hospitalised in intensive care units actually have COVID-19. The remaining in excess of 9 out of 10 patients are in intensive care for other reasons that you would usually be in intensive care, post-operatively, trauma, other infections, and so on and so forth, suggesting that we do have significant capacity within our system still before we hit that point where we would actually need to surge. This is great news for those who require intensive care for severe COVID disease. It's also, at least in part, one of the reasons why our results out of intensive care are so good compared to the rest of the world, because people can access care for COVID-19 as and when they need it, to the point of getting ventilated and cared for by our exceptionally experienced and world-class intensive care doctors and nurses. We've learnt so much over the past 4 or 5 months since this pandemic started. We continue to learn more, but all of those learnings are going into getting the best outcomes for patients who are severely affected with COVID-19.